All right, sorry everybody, just getting set up. I have everything set up here. I'm just gonna wait another 30 seconds while people are logging in. Feel free to let me know in the chat box if you can hear me. Hopefully you guys can all hear me. Wonderful, great. Wonderful. And this webinar will be recorded, so if your audio fizzles out at any point, we can have this posted or we'll send it out to you. From my understanding, this should be sent out after the webinar. Perfect. All right, so as we go along, just some housekeeping that I want to implement is just, I'm going to go through the slides. If you have questions, feel free to ask them in the Q&A section. And I will try to answer some of the questions that pertain to what I'm talking about as I go. And we'll go from there. And then at the very end, I'll try to answer some more questions as well. All right, here. Let's get started. All right, so I want to talk a little bit about myself. So I'm actually a registered dietitian. I've already been giving nutrition education and counseling for the past 5 years. I got my bachelor's degree down up at Oregon State University, then came down to California to do my dietetic internship. If you just want to hear more about my story, I just put my personal website there. But for here at Mexico Bariatric Center, I'm here to help you guys with your pre-op diet, your post-op diet, and just help you nutritionally along the way on this journey that you have ahead of you. So feel free to reach out to me at my email. I'm here for you guys. You can also email, you can text and call me as well. I do my best to get back to everybody in a timely manner. So I love hearing from all of you. And I'm going to jump right into kind of the agenda for today. So today we're going to be talking about the different phases of the post-op diet. We're going to talk about the nutrition goals that you should be setting for yourself for 1 month and beyond. And then we're also going to run through the vitamin regimen that you should try to follow. But first, I'm going to start out with the different phases of the post-op diet. So for the post-op diet, you'll actually start on the first phase, which is the clear liquids diet. This is going to be 5 to 7 days after surgery. The biggest point here that we really want to emphasize is hydration, okay? Your stomach just went through surgery, so it needs rest while it's going through this process. I'm going to pause here just for a second, and there we go. There we go. Sorry, I had to pause for a second. We're trying to put this live on Facebook as well, and I just got a notification. But yes, so the first phase is going to be clear liquid. The emphasis is going to be proper hydration. Your stomach just went through surgery, so we really want to give it rest, give it time to recover. And the goal intake is 64 ounces. The minimum is 48 ounces. We really want to avoid dehydration because this is one of the most common things that cause readmission into the hospital. I really want to emphasize that because you have gone through surgery, your stomach size has been greatly reduced. Your digestive system is adapting. So because it's smaller, you're only going to take in so much at a time. I always tell people you're going to be taking sips, not gulps. So it's going to be very important during this clear liquid phase that you're pacing yourself when you are drinking your liquids. Water may irritate your pouch, so starting small to like 1 teaspoon at a time, waiting 60 seconds in between each sip. And I always tell people aim for about 4 ounces per hour as a minimum. Something you can also do to help is warming up or playing around with the temperature. Warming up can help soothe and relax the pouch muscles. But I have, on the other hand, had people who had more of the nausea symptoms, and they find that having something ice cold can help in that case. So it's something to experiment with as you go through this process. We really want to avoid any pain or discomfort as we go along in this process. So I have some examples here on the screen for great options for clear liquid. We really want to avoid any carbonation. That's going to irritate your stomach. But going for water is great. Broth, especially broth because it does have some protein in there. I really like the sugar-free liquids like Vitamin Zero, Powerade Zero. These have electrolytes in them, which can help replenish your electrolytes and prevent dehydration. All right, I'm gonna pause for a second and see if there's any questions related to the clear liquid diet that have popped up. And I don't see any questions about the clear liquid. So I'm gonna move on. And then this is just giving you an outline of what to try. Herbal teas are okay, infused waters, the bone broth, pho is a great option, especially if you end up eating out for any reason. Just make sure you strain out any of the like bean sprouts and the toppings that they add into there. And you can have homemade popsicles as well. As for the things to be avoiding, I always tell people to avoid your caffeinated teas like black tea, lemon tea. These tend to be very acidic, as well as coffee. So I always tell people before going into surgery to start weaning yourself off, because as a fellow coffee drinker, it can be very difficult. So start weaning yourself off early so that this process isn't as difficult. Same with citrus juices and carbonation. That's something that we want to avoid at this stage. All right. And I did have a question, is apple juice good for phase 1? You can drink apple juice. I would just limit that. I would just want to check out if there's sugars, added sugars in there. You don't want a bunch of added sugar, so it needs to be 100% juice. And for juices, I would have less than a half a cup of juice. I would stick more to your vitamin waters and Powerade Zero. I think is going to be a better option for you. And any specifics regarding sodium intake. So if you're monitoring your blood pressure, that's something that you are going to need to ask your surgeon or medical liaison, because I can't give specifics for that one. I don't have your patient chart in front of me, but if you are already told to be restricting sodium, you need to be following those guidelines that you have been given. And that looks like all the questions on clear liquid. So I'm going to move on to our thick liquids. This is going to be phase 2. This is going to start on day 5 to day 7 after surgery. For each person, they tolerate things differently, but usually 5 to 7 days is the average. The big emphasis on this stage is going to be protein intake. You really want to emphasize getting 60 to 90 grams of protein per day, and choosing a protein supplement with at least 20 grams of protein and no more than 5 grams of sugar. I'm going to pause for 1 second and just check my Facebook stream for some reason. it is not streaming the way I would like it to. Facebook does not want to stream for some odd reason. Let's see here. Facebook is being fussy, but I'm going to continue on with you guys. So as I said, protein is going to be the biggest emphasis, and that's because protein is going to aid in your recovering and your wound healing. I also want to make sure that you are maintaining your lean muscle mass, but losing the fat instead. Okay, so it's very important to maintain the muscle mass with increasing your protein to 60 to 90 grams. And at the same time, you still want to maintain your hydration, so maintaining that 64 ounces per day. This is also the stage that you'll start your vitamin supplementation, and I will actually go through that on the third part of this webinar today. So I'm going to briefly skip over that part. And we're going to move on. So these are just some examples of things that you can try. There's this really great option of cooked oats with some protein powder and peanut butter in there to help elevate the protein content of that meal. I definitely recommend with cooked oats to try thinning it out with maybe some almond milk. Just because if it's super gummy, it's going to be harder for you to digest. So it's really important to try blending in that almond milk to thin it out. Another option is a lot of people really like to try soups. So we have this recipe here of a creamy vegetable soup. The original recipe does recommend half and half, but I would try oat milk at the beginning instead, because these heavy creams a lot of times are hard to digest. A lot of patients post-op, they'll actually be temporarily lactose intolerant. So we want to avoid things like heavy creams and stick more to our alternative milks at this time. So definitely try it with oat milk first, and then if you're tolerating that well, down the road you can add in the half and half. And then another option is this peanut butter protein shake, which I think is really great. It's another great protein source with your peanut butter. I really like that it has yogurt in there too. The Greek yogurt also has protein, adding in your almond milk. And also I would really work on incorporating shakes that also have greens in them, like spinach and kale. The spinach and kale are going to be really great fiber sources for you, and it's going to really help you have a regular bowel movement, which is something that comes up a lot. I get a lot of questions from people who tell me that they have constipation and tips for that. So definitely adding in any greens that you can help a lot. And so here are the pictures of the food items. I also really want you to avoid any drinkable yogurts. These tend to have a lot of high sugars in them. Instead, I would like you to try the Fairlife milk. Again, I brought up the lactose intolerance, and so these actually have no lactose in them, and they actually have a digestive enzyme added in, so that's going to help you digest it and really avoid any of those GI symptoms of like nausea, bloating, diarrhea. Those are things that we want to avoid. So again, here I have things to try. Blended soups are very popular. Protein shakes, again, the fruit and vegetable purees. That fiber is going to be very important for regular bowel movements. Making sure with that too that you are drinking plenty of water and also moving your body, starting to walk whenever you can. That is also what's going to help you have a regular bowel movement. And clear proteins are great. Thinned beans, puree them are also a very great option. And as I kind of mentioned earlier, those high sugar flavored yogurts are not really something we want to be incorporating at this time. Same with ice cream, sorbets, smoothies that you get from chain restaurants, and store-bought baby food. These all tend to have high sugar content in them, and that's something that's going to cause dumping syndrome if you have too much sugar at once. All right, so I do want to stop for questions at this point on the thick liquid diet. So I'm going to pop over here to the Q&A and just check if there's any questions that I have for this section. Let's see here. Okay, so I have some questions. Why do you always give up coffee? The coffee is because caffeine has the acidity in it, and coffee tends to be very acidic. And we want to avoid high acid foods because that's going to irritate your stomach. Premier protein shakes are a really great option. I always say that's good. A good tip too is if you're unsure, always just look at the back of the nutrition facts label. If there's less than 5 grams of sugar and more than 20 grams of protein, that's usually a good protein source. And those vegan plant-based proteins tend to be the best ones that are tolerated before and after surgery. Clear protein powder. So there are clear protein drinks, like the Premier also has a line of clear protein drinks. You just want to make sure that there's no dairy in it, because I brought up the lactose intolerance earlier. If you're ever unsure, feel free to take a screenshot of the protein that you're interested in and sending it to me, and I can let you know if that's okay or not. And pH wise, I would aim for 6 and a little bit higher. We want to get closer to that neutral, closer to that water pH. Isopure is another great protein option. And phase 2, yes, phase 2, you're still going to be taking small sips during this stage as well, and the 4 ounces per hour of hydration. And yes, Premier Clear is great. As for the type of procedure, I am not the best person to ask for this one, but there's actually a webinar tomorrow that will be going through the different surgeries that I recommend you signing up for. Okay, I'm going to move forward so we can get through more of the content, and I'll answer more as I keep going. Let's back up here. Okay, yep, so now we're on phase 3. This is your pureed soft solids. So this is going to begin 10 to 21 days after surgery. It's really important that when you're transitioning from your thick liquids onto this next stage, that you really check in with yourself, make sure that you're not having GI symptoms, that you've been tolerating your food very well up to this point. This means no pain in your abdomen, no diarrhea. We don't want any nausea or vomiting as well. But once you have good toleration of your food, you're ready to move on to pureed soft solids. So this is going to begin 10 to 21 days. The big emphasis here now is going to be structuring your meals. So this means 30 minutes before eating, you want to stop any liquid intake, and same with 30 minutes after a meal. You don't want to be drinking water before and after. And a big reason for this is because if you're going to be drinking water before you're eating, you're going to be filling up the limited amount of space in your stomach. And then you're not going to have as much room in your stomach for your protein-rich food and some more nourishment that you need. And then if you're drinking water too close to after, like finishing a meal, this is just going to have everything run right through your system, and you're going to have really unpleasant GI symptoms from this. So definitely making sure you're structuring out your meals, okay? Making sure the texture is soft. You're going to want to puree these things into a blender. Make sure you can mash it with a fork. It's really important to consume protein at all meals. And then you want to eat slowly and chew your food properly. And I always recommend introducing one new meal at each meal, or one new food at each meal time. And keeping a diary of the foods that you are adding back in and just your symptoms throughout the day, because this will help you plan out meals that give you the best nourishment, and so that you can avoid any unpleasant or discomforting feelings while you are eating. I also do recommend that patients buy a food scale. And a big reason for this is it just helps you gain more awareness of what you're eating. It really helps you with counting your macros, which is something I'm going to talk about later on in this webinar. So definitely invest in a food scale. If you don't have one yet, a way that I kind of get a reference is protein usually should fit a little bit less than the palm of your hand. But again, everybody's palm size is slightly different, so that's why I really do encourage getting a food scale. It's going to be your best measure. And again, I do recommend, I would recommend upwards to 3 to 4 ounces, but definitely starting out, you'll probably start out with 2 to 3 ounces of protein. And then carbohydrate 1 ounce, and then a teaspoon of fat when you are creating your meals here. And then this just emphasizes that you want to be chewing your food to an applesauce consistency and structuring 3 meals a day, usually 1 protein shake a day. This is going to help you elevate your protein intake and reach that goal of 80 to 90 grams. So some options, we have an avocado chicken salad. You can notice the ingredients, there's lots of veggies and fruit in there. So again, lots of fiber, which is really great. And then there's a low carb pork roast. And again, you can see all the fiber in that. And then we have this really good protein-rich dish that's cottage cheese egg salad, which I do like how much protein is that in that. You've got your eggs and your cottage cheese. And there we go. So kind of what I've emphasized, trying your protein foods, limiting the dairy, so choosing cottage cheese is okay, and Greek yogurt is okay. Avocado is a great fat source as well that you can add in and mash that up. You do want to avoid eating raw vegetables. You want to avoid white bread, popcorn. You want to avoid processed meats and red meats. And then having cookies and desserts. We don't want too much sugar because that's going to irritate your pouch. Because we really want to limit our sugar intake. So I'm going to stop here and just check for any questions on our soft solids. This was a lot of information, so I know there's probably going to be some questions here on this. Where can we purchase a food scale? Well, I am a Target shopper, and I know I've definitely seen it at Target. I'm not sure that one. Maybe in the chat box, some of you can share where you bought them. I know Amazon, you can buy some on there as well. Yes, a digital one. So then we have some people who are having trouble adding protein in, being at a little more than 1 ounce and trying to aim to the 2 and 3 ounce. It's really important to listen to your body. You don't want to force yourself. You don't want to force in food by any means. So it may just be that you're going to have to be patient with your body, listen to the symptoms, but definitely choosing protein over other things is going to be helpful, like choosing a protein-rich food over like a mashed avocado, for example. So let me answer that. Good proteins is going to be, I always recommend the plant-based, as I said, Premier. If you're having watery stool, that's going to be where you want to be adding in your fiber. Okay, so we do have a question on if a protein powder or shake contains whey. So whey is a form of lactose. If it does have, excuse me, if it does have hydrolyzed whey, that will be tolerated well. You can also get one that has like whey isolate in it. A lot of the Premier proteins have whey isolate, and that's tolerated pretty well as well. Should we sip from sippy cups to control intake and not use straws? Yes, so you don't want to use straws during this stage. I would avoid sippy cups because you're still going to be inhaling air at that same time. The reason we don't want straws or something where you're sucking in a bunch of air is that's going to add air into your stomach pouch and cause irritation. But that is a great question. Decaf copy, 4 weeks post-op. You can experiment with that. It's definitely going to vary from person to person just because of the acidity. Okay, I have another person talking about getting 30 ounces of liquids in and just having trouble getting more. Again, it's going to be listening to your body. It's going to vary from person to person. So having patience. I would recommend too, if altering the temperature, like I said before, that might help with the toleration as well. And then I have a question too, for limiting acidic foods, what about tomato soup? So yeah, tomato soup is going to be acidic, so I would go light on tomato soup at the beginning. Okay, we're gonna move forward back to here. So the next phase is going to be your solid phase. This is 21 days and onwards. So this phase is where you really get to work on making your own healthy meal plan. At this point, you should be able to tolerate most foods. There's not anything that is, you can never eat again. It really comes down to choice of what you want to add back in and what you're able to tolerate at that time. You should really aim on getting a variety of foods in to make sure you're getting adequate nutrition. Continuing to chew your food to an applesauce consistency, keeping track of the foods that you are tolerating well is really going to help, like I said earlier. Long term, you're going to want to try to get 3 to 4 ounces of protein in. You're going to want 1 to 2 tablespoons of fat, and carbohydrates 2 ounces. So I'm going to move into the nutrition goals 1 month and beyond, and this is going to tie it all together. So as I said, everyone tolerates the surgery different. I always say 1 month and beyond, you want to be trying to get 2 to 9 ounces in per meal. The average I say is about 4 to 6 ounces. So I would try to stay in that range. And as time goes on, your body is going to adapt and you are going to be able to add more in. But you do not want to force yourself, you don't want to force in any food that is causing discomfort because you don't want any complications from this. And you want to avoid overeating because if you overeat, this could cause stretching of your stomach pouch over time. So that's why we're going to kind of talk about macros and structuring what you eat. So I just want to talk about first the types of foods that we want to be adding in because the quality of what we're taking in is going to be very important. So food groups you really want to look at: oils and fats. I always recommend avocados and olives. Nuts and seeds are great, and nut butters. If you're cooking, I definitely recommend using oils over butter if you're trying to promote your heart health. So olive oil and flaxseed are great. Proteins, you have a large variety of proteins that you can pick from. So have fun with it. I don't want you to get bored, but you have lots to choose from: tofu, eggs, cheese, lean meats, poultry, Greek yogurt, seafood. And then same for carbohydrates. This is going to be your fruits and vegetables. One thing I do want to point out with the fruits that I kind of touched on earlier is fruits do have sugar in them, but they are natural sugars. But we still need to be mindful of that sugar intake. So I usually like to recommend people having half a cup of fruit per serving, just to avoid the high sugar intake, because high sugar is going to lead to dumping syndrome. So just be mindful of that one. I always recommend beans and legumes. Pseudo cereals are quinoa, buckwheat, chia seeds, oats. I also recommend Ezekiel bread. This is sprouted grain bread, so there's no preservatives, no flour, and it's high protein and fiber. So I have a sample day meal plan here, and I also have intake goals. So these are macros that I definitely recommend. At the beginning, you may only be getting like 800 calories in, but it's really important that you work your way up to 1,000 to 1,200, and pairing this with walking, starting the exercise, and moving your body. I get a lot of questions about when to start exercise, and usually the heavier weight-bearing exercises, you're going to want to follow the paperwork that you're given after your surgery, because it can range from 6 to 8 weeks. It really depends on the type of surgery you get done. But walking, you should be able to walk. So I definitely recommend getting that movement in. But feel free to message me at any time if you are curious, like, you know, what should my macros be? Because really it does vary from person to person. It depends on what your goals are, and it depends on how active you are. There's not one diet that just works for everybody. It's not a one size fits all. So have fun with the variation. So when I keep talking about counting your macros, I just kind of want to go through what that means. So it's important to understand that when you consume these foods from the different food groups, for carbohydrates, it's going to be 4 calories per gram. Protein, you get 4 calories per gram as well. And then fats actually mean 9 grams. So when you transition this into counting your carbs, say you want to get 30% of your intake as carbs, you would take, oh, here there's an error, but it should say 0.30 times 1200 to get your 360 grams, and then 360 divided by 4, or that's the calories, and then 360 divided by 4 is going to give you your 90 grams. So then if you follow protein, 0.35 times 1200 equals 420 calories, divide by 4, you get 105 grams. And with this, I always get asked about the keto diet. The keto diet, it does emphasize 5 to 10% carbs. I don't personally recommend the keto diet when you are on your 1 month and beyond. Honestly, I don't recommend most fad diets. The bariatric surgery is going to be your tool. And so at this point, you really need to focus on fueling your body moving forward. So you really should stop the diets that have severe restrictions, avoid diets that are eliminating entire food groups. If you have questions about specific things, definitely reach out to me. I'm hoping to do more newsletters and blog posts about some of these fad diets and why they don't align with bariatric surgery. But at this point, I definitely recommend the macros that I had on the previous slide, making sure you're getting your nourishment in. So I'm going to pause and just take a look at some questions here in my question box. What type of fruit do you recommend? Honestly, the avocado seems to be very popular among people. I'll let you guys in the chat box share with each other some of the fruits that you enjoy. Ezekiel bread, yes, the Ezekiel bread can be found in the frozen section. And this is a really great question. If you are consuming protein shakes, does this count as the ounces towards your fluid intake? This is actually going to be separate. So you need 64 ounces of water or your vitamin water, and then your protein needs to be separate. Does swimming as exercises is an option? Yes, swimming is an option. I would check in with your paperwork after surgery of when they allow certain activities, because I'm not sure where that falls into place when it comes to when to start swimming. Can you explain net carbs? Yes, so the net carbs, this is basically taking the total amount of carbs, but then you're going to be subtracting the fiber. And then this is going to be more of, the fiber is what's going to be helping with the bowel movements that I said before, and is usually not what's digestible. So getting your net carbs is going to be showing you what the digestible carbs is going to be. Okay. Sugar alcohols. So yeah, sugar-free items are great. Some of them are going to have something called sugar alcohols. One thing to be mindful about sugar alcohols is for some individuals, this can actually cause dumping syndrome. So it's something that you're going to have to experiment with. Some people tolerate it well. Some people have a harder time with it. And then I'm going to talk about the vitamins more in depth in the next section. Okay. So now we're going to jump into the vitamins. So for vitamins, it's really important to include these into your regimen to support your health. The vitamins are going to help prevent any fatigue or weakness. It's going to prevent nerve damage, dry skin, your hair loss, bone health, muscle loss. And so here I have the guidelines highlighted of what is suggested for intake for the different surgeries. But I'm going to break it down here in a second, and I'm just going to go through what we recommend moving forward. So it's going to be really important to get a bariatric specific vitamin. I definitely recommend these Emerge vitamins because these will fit all your vitamin requirements. And the first one that I definitely want to recommend is the Emerge multivitamin, but the infusion. So this liquid form is actually what's going to help. This one's usually the best tolerated for your stomach. So I definitely recommend this as the go-to first before the chewables. And these actually mix with water, which is great. And they have a high level of all your multivitamins that you need. And they have 500 milligrams of your calcium. They also have some fiber, which you know I've been talking fiber. And they also have your electrolytes as well. And because it is liquid form, it goes right into your bloodstream, which is just what we want. Let me take a sip here really quick. Okay, so when it comes to soft chews, these are in the form for your multivitamin and your iron and calcium as well. And they fit all your vitamin requirements, and they're easy to absorb, and they come in a lot of different flavors as I have listed on here. And then we also have the chewables as well. And I really want to emphasize for this that these have a 4-to-1 ratio of nutrition compared to the generic. So that's why it's so important to get a bariatric vitamin versus a generic vitamin. A generic vitamin, you're going to have to take 3 to 4 more doses to get the same benefits. And this also goes for, I get a lot of people asking me about the patch. It's one thing if a product contains a certain amount of nutrition in it. It's another thing if your body's going to absorb it and utilize it. So I really recommend that these liquid and chewables are going to be your better route versus the patch. The patch does work for some people, but I always tell people if you're going to use the patch to make sure that you are getting your nutritional status evaluated quite often to catch any nutritional deficiencies early. So I definitely recommend these bariatric vitamins instead. And another thing to point out too is the generic ones and those gummy ones tend to have a higher sugar content, and I talked about earlier we really want to limit our sugar intake. we really want to be trying to get 25 grams or less of added sugar. So if your multivitamin and your, calcium, like if those already have sugar in it and you're taking that 4 to 5 times a day, you already are hitting your 25 grams. And then what's to say when your protein shake or protein powder has sugar in it as well? You're going to be raking in quite a bit of sugar just from all of that. So definitely recommend this route. And this shows you the comparison. When you compare the generic to the bariatric, you can see that it has way more nutrition, less sugar. It's really quite obvious in this one. I also want to recommend too, for digestion, to take a digestive enzyme or to take a probiotic. For the probiotic, I always tell people pick one that has more strains in it and that has 50 billion CFU or higher. So this kind of helps create a healthy gut microbiome. So having healthy bacteria in your stomach to help or in your digestive system to help digest your food. And they can also boost your immune system as well. And the digestive enzyme, again, that helps with your nausea and really aiding in digestion. So I want to pause now and go through some more questions with you guys as we wrap up here. So let's run through some of these last questions. I have a question about stevia. Stevia is good. That one is good to consume. When should you take a probiotic? So you want to take a probiotic. You can actually take this before your surgery. I actually take a probiotic myself right now. The only thing is that when you are going into surgery, they recommend that you stop your probiotic 2 weeks before surgery, and then you'll start it back up again when you start your thick liquid diet, so 1 week after your surgery. It's a really great question. So when do we take the calcium citrate? That's a good question. So it's important that usually you'll have a multivitamin and then you'll have a calcium and then an iron supplement. It's important not to take the calcium and iron at the same time. So you might start with your calcium and then at your snack time have your iron supplement. It's important too that you do have some food in your stomach, especially with the iron, because that tends to have a rough effect on the stomach if you don't have any food in there. And then I have questions about hair loss. So the multivitamin actually has biotin in it, which really helps prevent hair loss. And it actually is 200% of your daily value in there. So you are going to be all set to go with a multivitamin. And these are online. The Merge Bariatric Vitamins are online. And I can also send you a link too if you have questions. I have a question about snacking. So you're fine to snack. This may be a way for you to make sure you're getting your nutrition in. Just making sure that when you are snacking, it's going to be on the quality of your snack. So choosing protein-rich foods first still when you're snacking as well. But sometimes, because you're having smaller meals, it is good to have, 2 or 3 snacks in there to just make sure that you're meeting the macros that you set yourself up for. And then I had a question about the soft chewables making somebody sick. I would really recommend the the soft chewable multivitamin, I would really recommend trying the liquid one. That is usually best tolerated. And yes, there's iron chewables. Constipation, how to leave that. I mentioned it earlier, you're going to want to increase your fiber intake with the fruits, vegetables, adding in the oats, making sure you're moving, staying hydrated is going to be very important. So more than 64 ounces of water. Can we eat beef? So red meat tends to be harder to digest. So this is going to be one of the last things that you're going to be adding in to your diet. So you're really going to have to experiment, but this is going to be something you're adding in, you know, beyond 1 month. Okay, and this webinar, this will be posted on the Facebook Live, and then it should be recorded and sent out to you after this, after I close out the presentation. If it's not sent out to you, again, feel free to email me and I will send you a copy as well. I'm going to end it now. I had such a great time answering your questions. You guys have lots and lots of questions. If I didn't get to it, I'll try to answer it off the webinar. And then also feel free to reach out to me. Like I said, I'm here for you guys. I'm here at your convenience. I just want to help you guys succeed on your journey. Yeah. Thank you all for coming to our post-op diet webinar, and I'm looking forward to hosting many more webinars with you guys. Let me know in the chat box if there's topics that you're really interested in, and I will check that out after the webinar, and it'll give me some ideas of how to meet your guys' needs the best. Thank you all for coming in today, and thanks for tuning in. I look forward to talking with you all after the webinar. Bye, everybody.